Hello, hello. Welcome to Thursdays with Whitman-Walker. We have a special treat for you guys today. We'll be talking to some of the team from Whitman-Walker about vaccinated experiences. So, come on in, come on in. Welcome to our Thursday chats. Thursday chats with Whitman-Walker. Come on in, come on in. We've got a couple guests today. We have 5 guests today, so stay tuned, stay tuned. Okay, let's see. All right, so we have our first guest. Hello, hello, hello.
Hey Orlando, what's up?
How you doing, Brandon?
I'm doing great. Just here to promote Whitman-Walker, and I'll be talking with you in a few.
Sounds good, sounds good. All right. So, guys, for those of you that don't know, I work with Whitman-Walker as a social media influencer. So today we have a special treat for you guys, talking about vaccination experiences. So, come on in, guys. Come on in. Let's see. So, if you have any questions, guys, make sure to please ask us. We will be on. Let's see. So, Brendan, are we going to have a guest while you're on as well? Oh, I think we froze up. All right,
I think
so
people are having a difficult time getting into the live.
got it. Okay, yeah, you froze up for a second. No worries. So let me start up. So guys, for those of you, like I said, we are going to be talking today about COVID vaccination experiences. Americans started getting COVID-19 vaccines around 2 months ago. Since then, around 12% of the country has received the first dose, and about 5% of the country has received the second dose. So through those amounts, to tens of millions of Americans getting vaccinated, that's a relatively small percentage of the country. Many folks have questions about what it's like to get the vaccine, and there aren't too many finished firsthand accounts yet. So tonight we have a couple guests as healthcare workers have received 2 doses of the vaccine, and they're going to tell us what it's like when they got vaccinated and answer any questions that you have in the comments about their experience. So when they join in here, don't be shy. Ask questions. I will be asking them questions as well. So let's see who's going to be our first. Okay, let me see. I have a. Let's see. Brandon, can you hear me?
I can, yeah.
Okay.
I think people are just joining the live now.
I'm sorry.
I think, why don't we talk to Jewel first?
Okay, sounds good. Jules, if you're in, come on in, Jules. I don't know if everybody's updated their phones. They might not be able to get in if we already have 2 people. I noticed because of the new system, they won't be able to get in. Let me see if I can request someone. Jules coming from which page?
I think it's like her last name, Suzaheta Addy.
No, but I think she's. Oh, I got it. Here we go. me send her a request. Jewel, if you're in there, I'm requesting you now. Hello, Jewel.
Hi, Orlando. Hi, Brent.
Good. Thank you for joining us. First time we're trying this more than two people in a live, so bear with the viewers.
Yes.
Join us for the adventure. So, Jewel, do you want to introduce yourself?
Yeah, my name is Jewel. I work in our external affairs department at Whitman-Walker Health as director of communications, and my pronouns are she, her, hers. And I'm super excited to be here.
Well, thank you so much. So, everyone, if you have any questions about vaccinations, please ask. I'm going to ask a couple questions. So, if it's something that you still want to know, please ask, and Jewel will do her best to answer that for you. All right. So, Jewel, the first question is, when did you get your COVID-19 vaccine, both first and second dose?
I got my Moderna shot in mid-January, and then I got my shot in February. And I was one of those lucky people who didn't really have any side effects or symptoms. The first shot is usually, easy breezy for everyone for the most part. But it's the second shot that usually gets folks. And so for me, I got like a really minor headache and really minor body aches. But after a couple hours after getting my shot, I took some Tylenol. And then that was kind of the end of the severe symptoms for me.
Beautiful. That's a great thing to hear. I finally got my first one actually, so
Yay!
soon I'll be part of the complete vaccinated stories here on Whitman-Walker. So tell us, how was your experience? Did it go well? Any challenges besides the side effects you didn't have?
Yeah, no, mine was super smooth. I was able to schedule my appointment early on in January, and I went like up the street from my home to Mary Center, and they were super quick, super efficient. You There's like a number where you took a piece of paper and then just waited for a bit till they called your name. You went up, signed some forms, and they gave you kind of the information that you needed for after your vaccination, and then they called you back to the spot, and then you waited for 15 minutes, and then you were out. I ran into someone who was like one of our first ever board members and board presidents at Whitman-Walker back in able to kind of be there with them who they've navigated a public health crisis, and now we're in the middle of a crisis. So that was an interesting coincidence.
Wow, how crazy is that? What a good thing to like experience. Um, Perfect. So let's see. The next question we have for you is, what should people know that they might not know about the vaccine or the vaccination process?
So back when I got my first shot in January, DC had people basically like get online and sign up for an appointment. First thing at like 9 a.m. each or whenever they release appointments. Now they've changed their process. It's no longer a and sign up kind of thing like how you would get your African American History and Culture Museum tickets. Now it's a pre-registration system, so you can just go in and kind of fill in contact information on coronavirus.dc.gov or vaccinate.dc.gov, and from there they will reach out to you about an appointment when you can schedule. And so you just need to respond within 48 hours of getting that contact, and then you'll be able to schedule your appointment. And I think also people should know, like lots of folks think that once you get your vaccination, you will just be able to kind of navigate the world freely, which the CDC has released some recommendations about what you can do after being fully vaccinated after the 2 weeks after your shot or your last shot or your one J&J Johnson & Johnson shot. But I think it's important for folks to know that the vaccine does not prevent you from actually getting COVID, and they're still learning whether or not it prevents you from spreading COVID to others if you were to get it. But it just helps prevent severe illness with COVID-19, death, and hospitalization from COVID-19. So that's what the vaccine does. It doesn't stop you from getting COVID. We don't know if it stops you from spreading COVID, but it does keep you a lot safer and reduce your risk of hospitalization and death.
Very, very important, guys. So even if you are 2 weeks after your last vaccination, still wear your mask. If you're around people who are not vaccinated, be super careful because, like they said, we are not sure if we can spread it, and those are the people who will be affected. We might go on and not even notice we infected somebody, and that could be super crazy. So be super, super safe. Great, great. Jewel, anything else you want to let us know before we move on?
Uh, I think that's most of it for me. If folks have
Yeah,
any
girl, you gave us a lot of information. We
uh,
love it.
I think if folks have hesitations around getting vaccinated, talk to your friends, talk to your medical provider, really what's preventing you from getting it. It could be medical mistrust, which totally makes sense. There's been a lot of history around unethical behavior when it comes to medicine and science. But I think, decades have passed, people have kind of grown to complete research studies and science advances with community advisory boards and just making sure that people who are going to be by these medical advancements have a say and a seat at the table. So just talk to your peers, talk to your provider, talk to your community.
Well, thank you so much, Jewel. Thank you for joining us and hope to see you soon.
Same. Can't wait to get back to class. Have a good
All
night.
right. Take care. All right. So that was our first guest today. I'm not seeing anybody come into the live. I know there's people here, so bear with us. If you're trying to write a comment and we can't see it, also bear with us. We're going to post this after, so just to have the information. If you have questions you really need to ask, go ahead and DM us at the Whitman-Walker or myself. That way we can try and, get those questions answered for you. But like I said, we are having a discussion today about vaccination experiences. We have Brandon online. We just had Jewel online. And we should be having another guest coming in soon. So we'll give you guys a couple seconds to come in. Guys, give me a little comment in the section because I don't have my comment bar anymore. So if you can comment just to know you guys are in there and that we're receiving a comment, that would be great. Let's see. Brandon, do you see the comment bar in your live?
I see it. Yeah, someone just commented.
Okay, good. Because I saw weird. Like my pin is like just there and nothing is under it. Like when I actually wrote in the pin. But that's fine. As long as people can write, beautiful. All right, so let's see. Who's going to be next? But
You want to talk to Rama?
Let's see. I don't know. It doesn't have. Remember how we used to have at the bottom my little options for adding people? It doesn't have that anymore. Hold on. Let me do it from the top. Got it. Okay. Let's see if this works. Yeah, it lets me add it from the top. Super weird. We got to play with this a little more. Instagram, stop messing up your stuff. Hello, hello.
How
Finally.
are
Oh
you?
my God. Good. Thank you for joining us. I'm sorry Instagram has been acting up this whole day, yesterday, all these days. That you made it. I know.
I know about yesterday.
I know. You started that live like a couple times. I was like, oh my Lord. All right. Well, thank you so much. How's your day going?
It's going. Thank you.
Okay.
How
If
is
you want
your
to,
day going?
so far, so good. Running back and forth, up and
Good.
down, sideways. Can you introduce yourself for us, for those who don't know who you are?
Sure. My name is Ramatullah Keita. I work here at Whitman-Walker Health. I work in the community health department with all these amazing people.
All of us. There's more. All right. So, I mean, we're still going to ask the same questions here. If anyone else has any other questions, please, please, please ask away. So,
Sure.
tell us, Rama, when did you get your COVID-19 vaccine, first or and second dose?
I think my first dose was Christmas Eve. What a great present. And I got the Moderna as well, just like Joel, who just hopped off dead. And then my second dose, I believe, was January 28th. So about the beginning of February, I was fully vaccinated.
Beautiful. That's definitely a blessing. I wish I would have gotten on. I know you told me about it when it came out for Whitman-Walker, but I
It,
was like, that's DC, and I'm like, wait a minute, and I was just holding off a little bit to make sure I heard these stories, which is why we're alive here, is giving these experiences for those of you who are a little nervous or still kind of iffy about getting your vaccine. We just want you guys to know we're all here. We're all minorities. We're real people. We're all different, diverse people, and we've all going through the same experiences, the same pandemic. So hopefully this helps you guys understand that it's for a good reason to, help ourselves and help society in general. So perfect.
I,
So how was your experience? Did it go well? Any challenges or side effects?
My experience was great. I am a person living with sickle cell disease, so I do have a chronic illness. And I think for me, it was really important to ensure that I shared with my community and my space as someone, as a Black woman, living with a chronic disease and still getting the vaccine. Because when it comes to the studies, just folks, there's so much misinformation out there as far as like efficacy and things, who was included in the studies and things like that. So I think it was really, it's essentially for me, I think it's a gift to be able to share my story and get more folks to kind of see us in the spaces. My experience was it was great. Signage for me was pretty simple, not as strict as now, because it's when it first hit the market that healthcare workers, frontline workers were able to access the vaccine at a faster pace. So I do think that that had a lot to do with it. The breeze and ease of access, and it had a lot to do with me wanting to get it ASAP. And of course, protecting myself and protecting my community was definitely vital for me to getting the vaccine. My first one, I got it over here on 14th Street in DC. I'm a Maryland resident, but because I work in DC, I was eligible to get my vaccine in DC. So I was able to do that. So it was great. The symptoms very minimal. So one thing to know about sickle cell, you live with chronic pain, whether it's like with your limbs and things like that. So, and fatigue is constant, which is very similar to what the side effects of the second dose were. So for me, they kept me a little longer after my first dose, just to ensure everything was okay. And I did have an extensive conversation with my hematologist and my provider. And I think a lot of folks, just because they're signing up, think that they can't talk to their providers, in which you can and you should, have the conversation before you go and talk to your friends, as Jewel mentioned, and talk to your community, just to kind of see. That's why we do these lives, so folks can feel comfortable and just ask questions, and then, excuse my phone there. Technical difficulties.
No worries.
But so with that, it was, and then my second dose, same, about 28 days apart when it comes to Moderna, and it's a 3-week waiting period when it comes to Pfizer. And as we know, Johnson & Johnson is just one shot and done. So, and I think that a lot of folks, my second one was, I did not have side effects. I want to say they're really similar to my day-to-day sickle cell life. So I think in a way that kind of prepared me for it. So I was one of the ones who just, okay, it could be the vaccine, it could be my sickle cell, but either way, I was okay, and I feel great. And I kind of feel like a superhero when I'm walking around because of the vaccine.
That's a good feeling to have.
Right.
And I love the point that you brought up, because a lot of my friends didn't know that you can actually register where you work as well, not only where you live. So, register everywhere you can, because somewhere is going to be quicker than somewhere else. And who knows if wherever you work, that's what happened with me. My job got it for me quicker. Literally, they sent me the link on Friday for work, and I was able to get it the next Tuesday.
Perfect.
It was like so easy. And then, I'm waiting for my second one. I'm also team Moderna, by the way. It's so funny because in Spanish, Moderna means modern, like modern girl.
And
So
you
I'm
don't
here for it.
hello.
So now you gotta say hashtag Moderna.
That's
And
gonna
that's
be
what
me.
you are. That's it. That's the new hashtag. So beautiful, beautiful. All right. So let me see, Rama. So anything, what should people know that they might not know about the vaccine and the process in general?
I think that a lot of folks are unaware of the fact that now everyone is starting to become eligible. Remember, our current sitting president did tell us by the end of April, folks would be getting the access to it, as far as like everyone is concerned, so people can sign up. If you are in Virginia, please ensure that go to the website, just Google it quickly. COVID-19 registration. Everyone is doing the pre-registration across the DMV, Maryland, Virginia, and DC. So make sure you do that. And I think there's a lot of us are kind of stuck on efficacy, the numbers, and Johnson & Johnson is 72, Moderna is 95, and
Right.
Pfizer is 97. And I think that let's just think about the flu vaccine and how this is a new kind of vaccine. This is an mRNA vaccine. We haven't seen a vaccine like this before. So it's completely, as far as the efficacy being in the 70s and the 90s, it doesn't really like all three vaccines are efficient and the efficacy rates are perfect. Like I would take all three vaccines, whichever one I can get my hands on, I would do it. So I think it's really important. Just ensure that you do your own research on it and don't hesitate to follow folks who are healthcare workers or people in your community, just your own little Google search. And then you can email Whitman-Walker or DM us to kind of ensure that you're getting the right information and continue the conversation with us. You know, I think it's extremely important. Pre-register your loved ones, pre-register your families, and I think the healthcare system as well is they have to hold themselves accountable to building that trust within the Black and Brown communities. As we know, it's valid. The mistrust is it's completely valid, but there are definitely things that have been put in place for us to for review boards and things like that for medical processes. You can't just get up and invent something and and not have without having a process before it gets to the people who need it. And the numbers are still alarming as to how many Black and Brown people are affected by COVID-19 versus who's getting vaccinated. So I think that's really important for us to keep that in mind. It affects our communities more, so we need to get out there, whether it's vaccinated and your vaccine, keeping a vaccine pod, a quarantine pod, and wearing your mask. It all works in unison when it comes to protecting yourself against COVID-19. It's not one or the other. So please keep that in mind. And
Yes,
we're always here to help.
very good information. And anything else you want to share with us today before we move on?
No, I think those were my final thoughts, and thank you so much.
Thank you so much, Rama. So we'll see you soon. I can't wait to do more lives with you. I love this whole you coming on here. I love
Right.
this energy. I love your vibe. You need to be on the camera, Rama.
LOL. Thank you.
Thank you. Have a great day.
Bye, everyone.
All right. So thank you so much to Rama. So we're going to have our next guest. Let's see. At this point, I don't even know who's next. So let's see who is here.
Let's talk to Paul.
Paul. Okay, perfect. Let me find Paul. He's been working with me adding them. Invite. Let's see. Paul. Paula. I got you, love. All right. So we're going to bring Paul, or as some of you may know, Paula. Hi, my love. How are you?
Hello. Good. How are you?
Welcome. Thank you. Good. So welcome. You want to introduce yourself for our viewers?
My name is Paul, and I'm the social media specialist here at Whitman-Walker.
Well, thank you, Paul. You want to tell us a little bit more about yourself? Tell us about your profile.
Okay. I guess I do drag part-time. Well, I haven't done it since the pandemic, but I'll be starting again soon. So very excited for that. I've been working on a lot of different looks and things.
Can't wait. Can't wait to see you back in some drag.
Yes.
All right, well, let's get to it. So we have some questions. Don't forget, everyone, if you have any questions, please ask them, and I will bring them up so I can ask Paul. But we're going to ask the same basic questions. When did you get your COVID vaccine? First and second dose?
So I got my first dose in January, like January 3rd or January 10th, something like that. And then I got my last dose on February 7th.
Okay, perfect. How was your experience? Did it go well? Any challenges or side effects?
The first experience went really, really well. I had no side effects at all. My arm was a little bit sore, but just as sore as it would be for a flu shot. I didn't have any like headaches or fevers or anything like that. The process was really easy. I went to Safeway. At that time, it was only available to people, healthcare workers and first responders. Second dose was super easy. I went still with Safeway, but it was at a different location. It was at actually like a senior living facility, I think it was. And that was super quick, like 20 minutes, and then I stayed for 15 minutes because of the you have to stay for 15 minutes in case there are any side effects. And that went well, but I had pretty bad side effects with a headache and a fever and things like that. I don't usually get sick, so it probably wasn't that big of a deal, but for me, I wasn't used to it. But
Right.
it went away within probably 36 hours, and then I was back to normal.
Okay. Beautiful. Beautiful. And is there anything you think people might not know about the vaccine or the vaccination process?
Um, Not really. I think, as Rama said, there's some people who, they want the Johnson and Johnson because it's one shot, or they want the Moderna because they think it's more um, effective. But I think as long as you can get any vaccine, I would get it. And then I think I know at first there's some people who said, well, I don't want to get the vaccine yet because there's people who need it more than me. And I know in Virginia, like on the 19th, anybody can get it. So I think if you have the opportunity to get it, you should get it, and don't think that other people need it more because at this point anybody can get it.
Right. And somebody asked about if 33-year-olds are eligible in DC or Maryland. So I would say check on the website because every state is different. So go to Maryland website or go to DC. If you work or live in either one of them, just go to Google and search, vaccination process, and they'll tell you what group they're in. Or you can send us a message to Whitman-Walker, and we can see if we can find out for you. All right. Anything else you want to mention before we move on?
Nope, I think I'm good.
Well, we appreciate you. Thank you so much, and can't wait to see you out and about and drag and all the fun stuff.
Yeah. Thank you.
All right, take care.
Bye.
All right, so we have two more guests that are going to talk with us today. So give us a second, everyone. Let's see. I gotta get Kevin in here now. Kevin, Kevin, Kevin. Anytime, anytime. Don't forget, send us a message. Don't be shy. And let me see if I can find Kevin. Someone's frozen. Hello, hello. How are you, Kevin?
Hi, Orlando. I'm doing well. How are you doing today?
Good.
Happy almost Friday. Happy Friday
Happy
Eve.
almost Friday. I know. I haven't seen you since I
It's been a
started doing
while.
the lives, and you came and helped one day. I remember. Wow, it's been almost a year,
It's been
actually.
before the pandemic, right?
Oh my, yeah,
Crazy.
it was right before the pandemic started. Well, thank you for coming. I think we lost Whitman-Walker, but let's
Hmm.
see. Okay, so let's just go ahead and answer the questions. I don't wanna spend too much time trying to get him back in. So introduce yourself for us. Tell us what you do with Whitman-Walker.
Hmm. Sure. My name is Kevin. I'm with Whitman-Walker Health. I work in our community health department. So I provide support for different things going on, including sometimes the life, such as this. And it's a pleasure to be here with you, Orlando, virtually and share this space
Thank
virtually.
you.
So
I
thank you for having me.
appreciate that. Thank you. Thank you. This is our first time together. So
Hmm.
let's see. So tell us about your COVID-19 vaccine, first and second dose.
Sure. So it was interesting. I had difficulty signing up, of course, through the website. I mean, I was eligible early on, but I just couldn't really connect for some reason. Just website was overloaded. So I kept on trying until I eventually was able to sign up for it. And I ended up having my first dose not too long ago, actually. And actually just got my second dose like about 3 weeks ago. Um, so it was just a matter of like trial and error for myself. Um, I ended up going to the Giant at the Turkey Ticket Recreation Center, and yeah, it was quite an experience because there were so many people lined up, and it was at a like a basketball court area,
Mm-hmm.
and there was some anxiety too, but um, I was just so happy to finally be able to get my vaccine.
And what was that? When did you get it?
So I got it on March 26th, the last dose. So the first dose I got on February 26th, and it was for the Moderna.
So you just have a nice little relief right now. Perfect.
Hmm.
So let's see. Did you
Just in
have,
time.
right, any challenges or side effects?
So no, and it was really interesting, Orlando, because I didn't have any side effects the first time. I didn't even feel anything when I got my first shot. I was a little bit worried that like nothing had happened, and I was just like, what's going on? Like I didn't feel anything. Like, did I get something? But yeah, no side effects. The following days, just a little bit of soreness in the arm, and that's about it. For the second shot, I for within the first 2 days, I didn't feel anything. I had my shot on a Friday, and so I intended to be laying down in bed all day Saturday and Sunday. That's what I was expecting, but I didn't feel anything. And I was actually a little bit worried because I was like, hold on, am I not supposed to have side effects and
Right?
be feeling like, my immune system, is gearing up and ready to kick some COVID butt. But yeah, I didn't feel anything within the first 2 days. And only I vaguely remember at night, like having a runny nose and just feeling like really tired and like overheating. But that's about it. I was honestly like worried because I'm like, is my immune system working? Right? Like, do I have the protection? But I did end up having just that runny nose.
You could just be tolerant to pain. I know a lot of us Latinos, we like are so like blind to when we get any like pain that we're just like, oh, whatever. That's that you call that pain. So like we'll have a fever or we'll have a headache and we're just like sleep it off, whatever.
Business as usual. Yeah,
Exactly.
definitely.
Exactly. I mean, hey, it is what it is. That's we
Hmm.
were taught when we were young, which is not always a good thing. So if you have some kind of pain, ask somebody, ask your doctor, just in case. You never know how serious it can be. But know your threshold, because at the end of the day,
Exactly.
it could be something wrong, and you're just letting it slide as if, oh no, I'll be fine. Just keep track and make sure you always have access to contact somebody. All right. So tell us, what
Hmm.
should people know that they might not know about the vaccine or the vaccination process?
Yeah, right now, what the information that was shared earlier by Jewel, by Rama, and by Paul, and by Brendan, and you as well, Orlando, is like really good information and tips. Just to check the websites, there is a pre-registration process happening right now, and I actually had a family member who did that. She lives in Maryland, and she managed to get an appointment like 3 days after pre-registering through the system. So it seems like they're moving quickly. So I would advise anyone that is still waiting or hasn't had the chance to register to go ahead and do the pre-registration on the website. We should have the links. We've shared them before, but for DC is vaccinate.dc.gov. For Maryland, it's a little bit different, but there is now a pre-registration process. And of course, there's a lot of questions and a lot of concerns. For myself, it was like after I got the vaccine, like, is it working? And I actually managed to speak with my medical provider and ask some questions and, just inquire about different things, right? Because I got the vaccine and it's like, now what? What do I do now, right? But even before that, if you still have any questions, any concerns, we strongly recommend that you check with your providers first and you ask them those questions that you have. And, if you're a patient here with us in Whitman-Walker, we do a lot of education and a lot of outreach and a lot of social medias and virtual spaces like this where folks can, like Rama said earlier, feel comfortable and ask questions. And we definitely want to encourage people to reach out to their medical providers if there's any pressing concerns or questions, right? Because those are valid.
Yes, very valid, guys. Always ask. I mean, they're the ones that, they're your doctors. They know what's going on. They know at least how to help you understand what's going on. So um, don't just hold it in. Talk to someone, talk to a friend. Maybe they have some information for you. DM Whitman-Walker. They're very aware of situations. Something that you think it might just be you. It could be anyone. It could be a lot of people going through that same experience. But if you don't say something, we can't figure it out without you. All right. So we appreciate that, Kevin. You have anything else you want to let us know before we let you go?
No, just that. I mean, I was so happy to get the vaccine. I think I was one of the first few people from my family to be able to get it, and it meant a lot. Now for me, like I'm gonna continue wearing a mask even after getting my 2 shots. I still, wouldn't feel comfortable like just exposing myself. So continuing to wash my hands and practicing physical distancing when appropriate, and just staying in touch with my medical provider, and definitely my advice is that you have a plan if you still haven't gotten your vaccine, and just explore what your options are, and definitely continuing on practicing washing your hands and wearing a face mask if you're in crowded areas, and if you're feeling sick with a flu and fever, staying home. If you have an appointment, calling before you go to your doctor's appointment, and all that good stuff, because um, there's so many other viruses and flu season
Oh yeah.
as well. So, and I haven't gotten sick using my face mask this past year, so I'm pretty happy about that. So it's a practice that I will continue doing.
Must. We have to, because we didn't notice how we just let germs be anywhere. We used to touch anything. Like, we didn't notice how much germs we could have, got in one day until like we were like, okay, we need to stay away from these germs. So super crazy.
Definitely. And
So
it's amazing now, like, oh, I'm practicing social distancing, I'm washing my hands, I'm double masking in some cases, and I'm like, it's curious, it's interesting, I haven't gotten sick. So it's really good.
well, that's good to hear. I'm glad. Well, sounds good. Thank you so much for coming. We appreciate you so much, and we'll see you soon, hopefully in another live.
Thank you, Orlando. It's a pleasure to be here. Have a wonderful afternoon.
You too. Take
Bye
care.
bye.
All right. So we've had a nice little lineup today, everyone. Thank you so much for hanging in there with us. Let me see. We might have one more guest. I'll let you know in a second. We needed our first one who came in. See if he's available. If not, let's see. Then we can see. All right. So again, if you have any questions or any concerns, don't forget to send us a message. You can send it to me, or send it right to Whitman-Walker, because those are the ones I'll definitely be asking for anything that I can't answer, and I will not answer unless I'm positively sure, so I know that they'll be available. So in the meantime, don't forget, we still are doing appointments at Whitman-Walker. So I put the pin down in the bottom, and to make a COVID test appointment, it's 202-797-4439, or even for HIV and STI testing appointment. Okay, let's see. Give me 1 second, I think. Let me try something. Okay, let me try and send a request to our last guest and see if he joins us. If not, we'll wrap it up. No worries all. Thank you for hanging in there with us today. We had a nice little chat with a few of our Whitman-Walker team. So I appreciate you guys hanging in there, meeting some of them. A lot of them don't really go live. Some of them do once in a while. But we do appreciate you guys hanging in there. Let's see. If we get our last one, we have done our job for the day. Let's see. I sent a request. Brendan, let me know if you got it. And thank you, Jewel, for coming in with the logo. We appreciate you too. So let's see. And don't forget, we're still in a pandemic. So even if you are vaccinated, try and stay 6 feet away. And wear your mask in public, avoiding places with large crowds, encouraging working from home if possible. Speak with loved ones on the phone or FaceTime instead of in person. Social distance to care for your community. Stay up to date on local, state, national guidelines for testing, quarantine, and general safety. Washing your hands for at least 20 seconds at a time. And make sure you stay home if you don't feel well. So I don't think it added our last guest, but no worries. We'll bring him on another day. We're going to definitely do this again. The more we get vaccinated, the more people we're going to have to come and share their experiences with us. Let me see. Somebody has a question here. Let's see what it says. Can't see. I wonder if they show. I see the question bar, but I don't see. Oh, it says we can't comment. Yeah, that was going on earlier. Thank you guys. So sorry about that. But again, thank you so much for joining us. Don't forget to follow Whitman-Walker on Facebook, Instagram, and Twitter, along with Real Talk DC to stay up to date with all Whitman-Walker Health Clinic, with lives, with things that are going on, with more information we get, the more information we're going to get to you guys. We appreciate you all. We see you. Again, I am Orlando, and thank you so much. You guys have a great rest of Thursday and a great weekend. Enjoy the weather.